There it is. Perfect.
So honestly, I didn't know what GONSTEAD meant until you just told me.
It's a very specific approach to spinal care, but more so for like the entire nervous system. Because that's what we're doing. See, when people are hurting, oftentimes you just say it's muscular because they're not like, dropped on the floor with like, whatever nerve pain. But the muscle is innervated by the nerve, the skin over the joint, and the joint itself is innervated by the nerve. And it's just, the brain's way of receiving the pain. It doesn't mean it's like mind over matter. That's not what it means. It's at what level is there something that's causing pain that's communicating with the brain to say, this needs to change, like to go back to optimal. And that's what we do. We try to make the adjustment to where the brain can then the brain and the body communicate back and forth to say, this is now optimal and it can heal. And that's the whole thing with being specific. So sometimes adjusting one bone versus adjusting 3 or 5 because you want to give the body a chance to like prioritize healing. What's interesting is that you have pain sitting up straight and it feels okay to slouch.
Yeah.
Which might just be, changing positions is something that's good for relieving, pain. Like I can't tolerate being in the same position for a certain amount of minutes. Because by you liking cobra pose or lying down on the stomach and that being more comfortable than being in child's pose, you would think that sitting up straight might feel better. But what I really should be saying or advocating for is the fact that it's never really one problem. You might have a flexion intolerance in one joint and an extension intolerance in another. No, it's never going to be 2 joints in a row, like one's flexion intolerant, one's extension intolerant. But it's going to be through here, might not like being in extension, and we got to find out a way to get this to be more comfortable in flexion. And then this is obviously going to like extension. Oh, I can already feel. This is a little maybe tender where my fingers are.
Yeah.
All right, what's more tender? Go ahead and lean back into my hand. Yeah. Right there or right there?
Right there.
So it's definitely a lumbar issue for today at least. And as for the pelvis, let's see if we have rotation. So let's start with that. So when I was looking at this earlier, the first thing that actually stood out to me was the deformity of this bone. See how it's almost like got like gremlin ears? And then this one's like a little thinner, but this one's like just bigger.
Yeah.
So this is healed in a weird way. And that's that 4th lumbar. And then when we look at it from the other side, you'll see what I mean.
Is that the side that's hurting?
Yeah. This is when I bent it to the right.
Yeah.
That's what was kind of hurting. And pushing just through here on these two, like L3, L4, was, pretty painful for you. Now, yeah, we just activated it, but it sounds about where the pain is for you, like all through here. Now, just looking from like P to A, your body is running this way. It's subtle, but it is running to this way. Usually when you see like an antalgic lean, like a true antalgic lean, I mean, the whole body might be like shifted over to the left. Yours is very, very subtle, yet it is running away from like a stretch pain over here. There's something that's being pulled and aggravated, probably aggravated around this disc or this disc. And when those discs, so in here, we have bone, disc, bone. And whenever the disc in here, these like little angled fibers are called annular fibers. So we always think about the herniation that pops out the back of the disc and it pushes on these nerve root and then it shoots down someone's leg. But in your case, I think what happened was the ligaments got stretched in between, and they look like this up here. Like these ligaments, these white ligaments.
Yeah.
So they're in between all the bones and all the discs and all the joints as well, kind of like what you, when you hurt your ankles. So what's happened is, on your right side, this is kind of what's happened. And there's some stretching of some ligaments because this disc is agitated. Now, whether or not it happened from the fracture, it's hard to say. Really young, resilient, can heal. But it's possible that something got aggravated over there, and you being so athletic through all the years, and especially doing things like yoga, where you spend a lot of time in flexion, is actually very detrimental to the disc. So that's why it's so important and also
And that
good.
pose hurts after a while.
This one?
Yes.
Yeah.
I have to bend my knees, so I'm like,
Yeah.
yeah.
So I'll tell you right now, your bread and butter, it's very complex. So this is what, I'm gonna take a guess and then I'll know over the course of a few weeks of working with you. So your bread and butter is gonna be, when you're done exercising or you're doing a yoga routine, to always come to like a plank and then dropping the pelvis to decompress your lumbar spine. However, if you do this too long or you don't have enough chiropractic care to, forgive the expression, crack and inhibit some pain in certain areas, you're gonna then have to go to like a tabletop up here like this, so you can round that top part of the lumbothoracic spine.
Okay.
Because
Like round it down on the floor?
like so in the position that I was just in, the whole idea is actually, let me pull up the lateral view for you, and then tell me if you want me to repeat it, which I absolutely will. Okay. So when you're on the floor in like that cobra pose, that's going to start to let the disc sink back in through here. Problem is it binds them pretty bad. So if you're doing like some disc management from spending so much time in sort of these kind of poses, and especially something like this, that would be really bad for the disc, but we'll talk about that after.
Okay. Wow.
Then you have to go to that tabletop with like legs up on a chair over here, kind of that's an anterior pelvic tilt, so posterior pelvic tilt, to open this back up. Even though you just took care of the disc, it's not like the disc seeps out when you're doing it alone like that. It would take a significant amount of time for you to be on your back. But the point is, you want to decompress this area because they jam up when you're in that cobra pose.
Okay.
That's kind of understanding that you have more than one problem. However, focusing on the main one is to come into that cobra pose after doing so much flexion in certain yoga poses.
Okay. I actually avoid that one. It just hurts too bad.
Yeah, and that's because you have so much tension, through here. Again, is it from the fracture? I'm going to say yes, because you have this, and now we can go to that. This osteophyte is what we would call this right here. You have a bone growth in the back of the canal at L4, L5.
Weird.
So the whole idea is these spine models are a little bit sticky. So I got like schmutz on my hand, as we would say. Oops. So we'll look at it like from here. So that's that last L4, L5. This spine nerve root is probably aggravated, especially when you go into flexion, and even more when you pull the leg up, because it's tethering on the cord and the nerves, and it's possible it's getting caught on that piece of bone. So you're going to want to absolutely maximize, and this is what I'm going to do today, is you're going to see I'm going to adjust this bone today, and I'm going to take into consideration the fact that it's pulling slightly this way, and we're going to take it and put it back that way and just sort of decompress that whole area. Yeah, I mean, that's in a nutshell, that's how we're going to like start down there. But everything else is equally as important, and I'll write it all down for you.
Yeah.
Cobra pose and tabletop.
Perfect.
So you can manage it.
Yeah.
Is everything I'm saying making sense so far?
Yeah, so far it's like, yep.
Okay.
2 problems, so 2 different moves and exercises, and it's gonna take time.
All these nerves that come out of the thoracolumbar junction, as we would say, so like the T12, L1, L2, not only do they innervate the hip, both posteriorly and anteriorly, but they also innervate your IT band and your tensor fascia lata, right? You're familiar with that?
IT band,
Yeah. All right. So same idea. The fascia and the tendons that run from our hip and insert down on our knee. So a lot of times by getting the thoracolumbar junction straightened out,
on the right side.
we can get the knee to kind of miraculously all of a sudden
That would be
heal.
cool.
I might have to see you for myself.
So no promises is what would it say? Always under promise and over deliver.
That's what he says all the time.
So here's what I can tell you right now. I know with 100% certainty I can help you. To what extent, I don't know. But I have a pretty good track record. That's just me speaking.
I've done my research.
Okay.
Yes.
So I mean, it's
Been a long time. I haven't gone anywhere since 2016.
Have you seen any of the videos with like the thrust like this? It felt better going this way. All right, go ahead and take a nice deep breath in. All the way out. One more deep breath in. All the way out. Let your belly really fall and relax. And lift your chin up first. There it is. Perfect. Excellent. Oh, we just corrected probably the biggest problem in your back that you've had for a long time.
Wow.
Yeah. And we're going to take care of your knee now as well. Okay. So why don't you go ahead and take a seat right there, and you tell me if there's any pain or anything replicates.
Tender.
Does you ever get any pain here? Does this replicate what the pain is? No. Okay, so it's definitely when you feel it, it's deep in through here. Does this cause any pain in your knee?
No.
Good for prioritizing healing and acute inflammation because it acts like it's ice, you know? And I mean, heck, if there's anything to essential oils, then
I think there is.
obviously it's working. Times one of those